Have you ever paused to consider whether your everyday hygiene habits could impact not only your health, but potentially even how long you live? It's a question that might sound unusual or even surprising, but doctors are now drawing attention to several often neglected areas of personal hygiene that could directly influence our overall longevity. You see, most people assume that standard hygiene, washing your face, hands, and body, is sufficient, but research reveals that several lesser-known parts of our bodies often go overlooked, especially as we age. Our immune systems naturally become weaker with age, leaving us more vulnerable to illnesses, infections, and health complications. Even something seemingly small, such as neglecting hygiene in certain areas of your body, could inadvertently set the stage for problems that compromise your quality of life and potentially reduce your lifespan. In this video, I'll take you on a journey through 4 specific areas of your body that seniors should pay special attention to. I'll explain exactly why these overlooked spots deserve extra care and how simple hygiene habits can dramatically increase your chances of living a longer, healthier life. Some of these areas may surprise you, and others may seem obvious once pointed out, but they're all equally important. Make sure you watch all the way through, because the last area we'll discuss is particularly important, yet frequently neglected, and keeping it clean could make all the difference in your long-term health and vitality. And before we jump in, if you haven't already subscribed to our channel, consider doing so now and hitting the notification bell so you won't miss any of our future health tips. Your support truly helps us continue producing high-quality videos to educate, inform, and inspire you to live your best life. Let's start with a small but surprisingly overlooked area on your body, your belly button. Most people take showers regularly and believe they're getting their whole body clean, but the truth is many neglect their belly button. While it might seem harmless or insignificant, your belly button is a perfect hiding place for dirt, bacteria, sweat, and dead skin cells to accumulate, especially if you have an innie belly button. The small crevice in your navel provides a warm, dark, moist environment that encourages the growth of bacteria and fungi. This becomes even more critical as you age, because your skin becomes thinner, drier, and more sensitive, making you more susceptible to infections or irritations. A neglected belly button can harbor dangerous germs, such as Staphylococcus aureus, which can lead to uncomfortable infections, redness, itching, or even foul odors. In severe cases, these infections can escalate to more significant health complications, particularly in older adults with compromised immune systems. Consider the case of Mary, an active 76-year-old who prided herself on her cleanliness but never gave a second thought to her belly button. Over time, Mary noticed persistent itching and irritation in her abdomen. Initially, she ignored it, assuming it was just mild skin irritation or dry skin due to aging. Unfortunately, the problem worsened, leading her to consult a dermatologist, who revealed the source was bacteria and fungus accumulated in her belly button. Simple, regular cleaning could have prevented the infection entirely. Fortunately, preventing such problems is easy. Whenever you bathe, gently use a warm, soapy washcloth or cotton swab to clean your belly button. If your belly button is particularly deep or inverted, carefully use a cotton swab dipped in warm, soapy water, gently rotating to remove any buildup. Afterward, dry the area carefully to avoid creating a moist environment where bacteria and fungus thrive. This quick daily practice significantly reduces your risk of infection and promotes better skin health, ultimately enhancing your overall well-being and comfort. Moving on to another important yet frequently neglected area, your tongue. Many older adults pay close attention to dental health, brushing their teeth twice a day, flossing regularly, and visiting the dentist annually. However, oral hygiene often stops at teeth, with the tongue largely forgotten. The tongue, however, harbors millions of bacteria that toothbrushes alone might not remove effectively. As your immune system becomes weaker with age, bacteria accumulating on your tongue can contribute to multiple oral health problems, including bad breath, gum disease, and even fungal infections like oral thrush. Oral thrush can become particularly serious for older adults, causing uncomfortable symptoms such as white patches, difficulty swallowing, irritation, and even pain. Consider John, a healthy and active 74-year-old who took pride in his rigorous oral hygiene routine. Despite regularly brushing his teeth, John consistently struggled with bad breath and occasional discomfort in his mouth. Initially, he ignored the issue, assuming it was normal for his age. But when white patches appeared on his tongue and he began experiencing difficulty eating, he knew something wasn't right. After consulting with his dentist, John discovered he had developed oral thrush, primarily due to overlooked bacteria accumulating on his tongue. Thankfully, incorporating a daily tongue cleaning practice into his oral hygiene routine helped him quickly overcome the infection and dramatically improved his overall oral health. Cleaning your tongue is easy and requires just a few seconds each day. Simply invest in a tongue scraper, an inexpensive tool available at most pharmacies, or use your toothbrush. Gently scrape or brush your tongue from back to front, rinsing the scraper after each pass. Regularly cleaning your tongue eliminates harmful bacteria, reduces the risk of oral infections, prevents unpleasant breath, and supports a healthier mouth, directly enhancing your overall immune function and quality of life. Another crucial yet often overlooked area for seniors is behind the knees. Because the skin behind your knees often folds, this area becomes a warm, moist environment ideal for bacterial and fungal growth. Older adults, especially those with limited mobility or those who spend long periods sitting or reclining, often neglect this area, increasing their risk for persistent irritation, itching, rashes, and even chronic skin infections. As we age, our skin loses elasticity and moisture, making any area that traps sweat more susceptible to irritation, rashes, or inflammation. Take, for example, Linda, a 76-year-old retiree who loved spending time with her grandchildren. She noticed increasing discomfort, redness, and itching behind her knees. At first, she dismissed the symptoms, assuming it was related to aging or dry skin. However, when her symptoms persisted and intensified, she consulted her doctor, who explained that the irritation was due to bacterial growth in an overlooked hygiene spot. Once Linda began properly washing and drying behind her knees daily, her skin cleared up completely. Maintaining good hygiene behind your knees doesn't require complex or special methods. Simply wash this area gently each day using mild soap, warm water, and a soft washcloth. After washing, carefully dry behind your knees thoroughly to remove excess moisture. Regular attention to this area prevents fungal infections, irritation, and discomfort, ensuring that you stay healthy, mobile, and comfortable as you age. Another common yet underestimated area of hygiene involves the ears, specifically the outer part and folds around the ear canal. Older adults often focus on removing earwax internally, sometimes improperly using cotton swabs, but rarely consider cleaning the outer ear and folds carefully. These areas trap dirt, sweat, dead skin cells, and bacteria, which can result in uncomfortable irritation, odors, and sometimes infections. Ear infections, redness, itching, and bacterial buildup can become especially problematic in seniors who may use hearing aids, glasses, or masks regularly. These accessories often trap moisture, oils, and dirt behind and around the ears, providing an environment that bacteria love. Robert, a 78-year-old retiree who wore hearing aids daily, frequently experienced redness, irritation, and unpleasant odors around his ears. He assumed his hearing aids were the issue, never realizing the true cause was inadequate hygiene in the folds of his ears. When Robert improved his hygiene habits, regularly wiping his ears with a clean, damp cloth, drying them properly, and regularly checking the fit and cleanliness of his hearing aids, his symptoms resolved completely. Proper ear hygiene involves gently cleaning the external ear and the area behind the ears daily with mild soap and warm water, followed by careful drying. Avoid inserting cotton swabs deeply into the ear canal, as this can push wax further inward and potentially damage your hearing. Regular ear cleaning helps prevent skin irritation, infections, and discomfort, especially as your skin and immune system become more sensitive with age. In summary, maintaining hygiene in these often neglected areas, the belly button, tongue, behind your knees, and outer ears, is essential for older adults looking to improve their overall health and increase their longevity. These areas might seem minor, but neglecting them can significantly impact your health, comfort, and even independence. By adopting simple, daily hygiene habits, you not only enhance your physical well-being, but also improve your comfort, confidence, and quality of life. Small changes in your routine can deliver powerful benefits. Thank you so much for watching and staying with us to the end. Please comment below sharing what you learned today and how you plan to apply these hygiene tips in your daily routine. Your feedback and experiences are incredibly valuable to our community. Don't forget to like, subscribe, and hit the bell notification, as your support helps us continue providing valuable content that promotes a healthy, fulfilling, and vibrant life. We look forward to seeing you in our next video. Stay healthy and take care.